Senator from Illinois.
As consent to speak in morning business.
Without objection.
Madam President, I come to the floor today to discuss an issue that is important to my state and I think every state. Illinois, which I represent, proud to represent, is a state with a great American city of Chicago, but many other towns and cities of a variety of different sizes. I actually was born in downstate Illinois, 300 miles away from Chicago. And between the great city of Chicago and the rest of our state, there are many small towns and rural areas. And when you go into these areas and talk about the quality of life and living in small town or rural America, there are a lot of challenges. Just a few weeks ago, I was in Calhoun County, one of the smallest in our state. We had an assembly of kids in middle school and grade school, and we announced that the local electric cooperative, the Illini Electric Cooperative, was finally going to bring that level of access to the internet, which Calhoun County and the people who live there and those students had been waiting for a decade or longer. It took longer for it to reach there. I'm glad that the electric cooperative led the fight. Historically, the electric cooperatives literally brought electricity to rural America. Now they're bringing high-speed internet to rural America, and it's critically important for students to learn and for all of the other services that many people living in big cities take for granted comes with the internet. That's one example, but another one that you run into all the time are the comments of people in small town America about access to health care. Because you see, across our state, we have millions of people who live in smaller towns, rural towns, who don't have the same quality health care nearby, whether it's a hospital or a doctor or even a dentist. Across Illinois, 5 million people live in areas with shortages. 2 million live in areas without a dentist. Almost all of them live in an area without access to mental health providers, counselors, psychologists. The consequences speak for themselves. Only 1 in 10 people with substance abuse disorders get the care that they need in these areas. 43% of rural Americans do not have access to dentists. 43%. Well, there's a federal program that's been addressing it for a long time. And coincidentally, the presiding officer from Tennessee is the co-sponsor of legislation which I'm going to address at this moment. Today, there's a federal program in place called the National Health Service Corps. It provides loan forgiveness to entice doctors and other healthcare professionals to serve in places of healthcare needs. In total, 10,000 doctors, dentists, behavioral health specialists, and nurses use the National Health Service Corps and treat 11 million Americans each year in hospitals and community clinics. We entice them to come to these underserved areas by paying off their loans. And as you probably know, doctors and dentists and nurses and others end up graduating with a lot of student loans. Illinois has more than 550 of these National Health Service Corps clinicians, but fewer than 75 of them serve in rural areas. As we face an opioid epidemic that touches every corner of America, no city too large, no town too small, no suburb too wealthy to have escaped it. We need that kind of professional health care across the board, in urban areas as well as rural areas. That's why I've teamed up with the presiding officer, Senator Blackburn of Tennessee, in a bipartisan piece of legislation which we call the Rural America Health Corps Act. Our bill will expand the current core program to provide new loan forgiveness, funding for providers who will serve in rural areas in Tennessee, in Illinois, and across the nation. It provides funding for 5 years rather than the usual 2 to ensure doctors, dentists, and nurses plant their roots in rural America. With the National Health Corps up for reauthorization this year, Senator Blackburn and I are pleading with our friend, Chairman Lamar Alexander of Tennessee and Ranking Member Patty Murray of Washington to promote this rural focus. It isn't the only thing that I've looked at when it comes to rural America. I recently introduced a bill with Senator Roberts of Kansas. Senator Roberts is chairman of the Senate Agriculture Committee, and he agreed to include in the Farm Bill something called the Siren Act. The Siren Act provides funding to support rural fire and EMS agencies with training and recruiting staff and purchasing equipment, everything from naloxone to power stretchers. I recently visited Nauvoo, Illinois. Students of history may recognize the name of this town, but Nauvoo, Illinois is where a man by the name of Mr. Kennedy came forward and told me about the need for new modern equipment on their ambulances in this rural Hancock County area. Because of what he told me, I introduced the bill. It passed as part of the Farm Bill, and we're going to start making money available in rural parts of America for these emergency management specialists to have the right training and the right equipment to respond when needed. These bipartisan bills are important for rural health care, but we also have to maintain the structure of our key health programs. Thankfully, Illinois has expanded the Medicaid program through the Affordable Care Act, which has provided a funding lifeline to keep many of our rural hospitals from the brink of closure. It also expanded health insurance to 1 million people in Illinois. 10 years ago, when we passed Obamacare, the Affordable Care Act, too many Americans did not have health insurance. If you have ever been at a moment in your life where you were the father of a sick child who desperately needed medical care and you had no health insurance, you will never forget it as long as you live. I know, I've been there. It made an impression on me as a young father that I've never forgotten. And so when this bill passed, the Affordable Care Act, and I saw so many Americans finally getting health insurance, I knew it was giving them peace of mind and access to affordable, quality, accessible health care. This week marks the beginning of the open enrollment period to sign up for health care under the Affordable Care Act, which ends on December 15th. It is vital to make sure that everyone signs up at healthcare.gov if you are not currently covered and want to know what's available to you. Most patients will find their premiums are less than $100 a month, and if you're in certain income categories, you'll get a lot of help in making that premium payment. But the number one thing that I hear from constituents has nothing to do with what I've just mentioned. I listened to my friend from Iowa, the Republican Senator Chuck Grassley, on the floor a few minutes ago, talking about an issue that each of us runs into in every state in the union. Here's the question. If you ask the American people, what is the issue that you're concerned about from an economic viewpoint that you think that Congress can do something about? 90% of Democrats, 90% of Republicans, 90% of independents all come back with the same answer. You know what it is? The cost of prescription drugs. People understand that these prescription drugs are so expensive they're beyond the reach of many people who desperately need them. Now, there was a senator from Wisconsin years back named William Proxmire, and he used to issue monthly recognitions of the most flagrant, excessive examples of waste in federal government. He called it the Golden Fleece. Earlier this year, I launched a series of awards to carry on Senator Proxmire's work with a focus on the pharmaceutical industry, the people who make the drugs. This month, we have this sign produced as a way of notifying the world. This month, the Pharma Fleece Award is going to the drug industry's trade group, Pharma, and the Trump administration, I'm afraid, for a giveaway in the new NAFTA trade bill. What does the trade bill have to do with pharma or the price of prescription drugs? It turns out that Pharma, boy, they're good, managed to sneak in a provision in this trade bill that most members of Congress are not even aware of. This new trade agreement, as you might expect, involving Canada, Mexico, and the United States, covers a wide range of issues. My farmers are very excited about it. The men and women in labor unions are concerned about it. But it falls far short when it comes to labor and environmental protections. There's a lot of work that needs to be done. But the one provision that I want to highlight today is tucked inside this sprawling document. It's a provision that guarantees monopoly protection for pharmaceutical companies by blocking competition, generic drug competition. And it means that these companies can continue to call for sky-high prescription drug costs. This is just another example of an issue that the president said during his campaign was a high priority, and we all talk about on the floor of the Senate, is being sneaked into this new NAFTA trade bill. Let's remember, the top 4 drug companies avoided paying $7 billion in taxes last year, $7 billion, and were able to buy back another $30 billion in stock thanks to President Trump's tax reform package. It was very kind to Pharma, not that they need it. Americans already pay, incidentally, the highest prices in the world for prescription drugs, 4 times what's paid in Canada or Europe. So why would the administration agree to put a provision for Pharma to guarantee high prices into the new NAFTA trade bill? Listen to the story. In 2017, for example, Canadians could purchase a year's supply of Humira. Recognize the name? You should. It's the most heavily advertised prescription drug on television. Humira, made by AbbVie, a company in Illinois. It's used for a disease of psoriatic arthritis. Canadians can buy a year's supply for $20,000. Not cheap. Do you know what Americans pay for exactly the same drug, made by exactly the same company? Over $40,000. More than twice as much as the Canadians. Why? The Canadian government cares. They've said to AbbVie and to Pharma, we're not going to let you overcharge Canadians. We're going to protect our Canadian families and our Canadian healthcare system. The United States doesn't. Often, Big Pharma charges as much as it can get away with by manipulating our patent and exclusivity rules for competition. Drugs known as biologics, like Humira, Rituxan, Remicade, are medicines made from living organisms. They're known as biologics. They make up 2% of all the prescriptions sold, but they account for 37% of the cost of prescription drugs. Very expensive drugs. Those 3 biologics have all been on the market for more than 17 years, and yet they are still the top 7 highest grossing drugs in America, due to the fortress of monopoly protections that Pharma has created. Now listen closely. Under U.S. law, biologics, like the ones I mentioned, Humira is one of them, are given a 12-year exclusivity period once the FDA approves their application. What does that mean? No one can compete with them. They own the market. They set the price. That means that a cheaper generic competitor cannot be approved by the Food and Drug Administration in the United States for more than 10 years, while the brand name company is free to charge whatever it wants. Wonder why prices are high? There's no competition. I believe the standard is too high, and have co-sponsored legislation to reduce this period to no more than 7 years. Canada's exclusivity period is 8 years. Mexico doesn't even have one. But now let's go to the new NAFTA trade agreement. Let's look closely at the fine print that Pharma included in that. The administration wants to enshrine our pharma-friendly laws by setting a 10-year exclusivity floor for all 3 countries. It's a virtual guarantee that Pharma, when it comes to biologics, will be able to charge whatever they wish for 10 years or more in Canada, Mexico, and the United States. Why is that in a trade agreement? If all of us agree that prescription drug prices are too high, why are we putting into this NAFTA trade agreement a sweetheart deal for Pharma so that they can charge higher prices, not just in the United States, but in Canada and Mexico? This new NAFTA has provisions that would encourage drug companies to obtain excessive numbers of secondary patents that delay generic competition and keep prices high. So when my farmers come to me and say, well, why aren't you for NAFTA? I say to them, if it were just about farmers, it would be a pretty easy call. But it's about American families, Canadian families, families even in Mexico, paying higher prices for prescription drugs because of a trade agreement that the president wants us to approve. We should be working to bring lower cost products to market sooner, not allow Pharma to sneak a payday into a trade package at the expense of American families. It should come as no surprise that the main coalition running ads supporting the approval of NAFTA is the pharmaceutical industry of the United States. In fact, Pharma and Bio, the 2 largest pharmaceutical associations, have already spent $30 million lobbying Congress to pass this new NAFTA. Yeah, now we know why. For all of the President's talk, this provision in this trade agreement is a Trojan horse giveaway to Big Pharma at the expense of American patients. I guess we shouldn't be surprised, but I'll say this. If members of Congress, Democrats and Republicans, House and Senate, are listening to the people they represent back home about the cost of production drugs, they won't fall for this new pharma fleece. Madam President, I yield the floor. Suggests the absence of quorum.